Welcome to the first webinar in the Asian Development Bank's new webinar series, Asian Impact. This series will share expert knowledge and inform policy making on a wide variety of issues of high importance to Asia and the Pacific. Asian Development, Knowledge Management and Sustainable Development, Mr. Bambang Susantono, to kick off the series and set the stage for the discussion today on the global supply shortages of personal protective equipment, PPE. Vice President.
Thank you, Karen. A very good afternoon to those of you in Asia, and a very good morning or good evening to those of you connecting from other regions. I'm very pleased to host these inaugural sessions of the Asian Impact. This webinar series will be the vehicle to showcase ADB research work and also debate on issues that are critical for Asia continued development. Over the coming months, the Asian Impact will explore a wide range of development topics, including what is considered the biggest risk today and the one keeping Asia key decision makers awake at night, the COVID-19 pandemic. Without a doubt that the pandemic is posing unprecedented health, economic, and social challenges to Asia and the world. ADB has been working closely with our member countries from the outset of the pandemic. We stand ready to provide crucial financial and knowledge support as the government across Asia take extraordinary measures to contain the virus while supporting their people and economies. ADB comprehensive $20 billion package for a range of pandemic responses was approved in April 2020. This is a funding package that countries can quickly tap. It includes an emergency counter-cyclical fiscal support under the COVID-19 pandemic response options, or what we call CPRO. The CPRO is helping our developing member economies to mitigate the social and economic costs of the pandemic, including disease containment, social protection, economic recovery measures, and support to small businesses. The pandemic has exposed weak links in our economies. One of them is the global shortage of personal protective equipment. I hope you agree with me that of all the inequity and dysfunction exposed by COVID-19, the disconnect in our health sector is devastating. It is heartbreaking to see the image of frontline healthcare workers who are compelled to attend to patients without personal protective gears just because the supply chain has failed them. Some of them contract the disease when it could have and should have been prevented. The weak medical equipment supply chains are putting the life of our frontline healthcare workers as well as their patients at extreme risk. According to UNICEF, by the end of the year, low and middle income countries will need 2.2 billion surgical masks, 1.1 billion gloves, 13 million goggles, and 8.8 million face shields. To meet these needs, ADB is contributing to the strengthening of regional and global mechanisms to foster a faster and more cost-effective approach to procurement of much-needed medical supplies. This includes coordinating with the newly formed UN COVID-19 Supply Chain Task Force, WHO, UNICEF, other multilateral institutions, National Center for Disease Control, and our developing member countries. We have also increased our private sector support for COVID-19 response to $1.8 billion, which includes expansions of our supply chain finance program. Together with the commercial banks, we will support supply chain networks and trade finance, address working capital shortages, and provide loans and guarantees to both financial institutions and microfinance organizations. This is where we turn to the subject of today's sessions. Our discussion today will look at potential strategies for governments both independently and collectively to improve the global supplies of critical medical equipment and more broadly to enhance resilience in global supply chains in the longer term. In addition, experts from within and outside ADB will discuss the role of multilateral development banks in improving productions and logistic capacity, increasing trade finance, and protecting vulnerable sectors of the economy. So with this, let me officially launch the ADB Asian Impact Webinar Series, and my colleague Karen, who is a director with our Department of Communication, will take you through today's event. Karen, over to you, and the floor is yours. Thank you.
Thank you, VP, and it's really good to see so many people logged in and keen to participate in the discussion today. We have with us 5 experts. I'll quickly introduce them to you. They are Ms. Rafaelita Aldaba. She is the Undersecretary for Competitiveness and Innovation with the Philippine Department of Trade and Industry. Mr. Michael Griffin. He looks after strategic development and public-private partnerships with the World Health Organization. Ms. Sin Yong Park is the Director of ADB's Regional Cooperation and Integration Division. Ms. Suzanne Roth is Principal Knowledge Sharing and Services Specialist in the Sustainable Development and Climate Change Department here at ADB. And lastly, Mr. Jesper Pedersen. He's with the ADB's Procurement, Portfolio and Financial Management Department, and he is a Principal Procurement Specialist. So I'll shortly be turning to one of my colleagues to lay out some of the specifics regarding PPE supply chains. But just before we do, I'd like to give you a few notes on how this will work. There is a chat on the right-hand side. Please feel free at any point during the conversation to put in a question in that white strip at the bottom. Press the arrow button. The question will go to the organizer, who will put it in the publish button for me to see and for me to pass on to some of our panelists. If you can't see that chat box on the right-hand side, go to the bottom of your screen. You should see press that and the box should. Now, we'll get to as many questions as we can. We want to keep the it may take a moment to pop up, so don't fear, it will pop up. Now, ADB has done a lot of research into the supply chains of equipment. Ki-Jin Kim, he's economist with ADB's Regional Cooperation and Integration Division, and he's among one of those many who have asked him to quickly set the stage for the discussion.
Thank you, Karen, for kind introduction. So I'm very happy to present and to set the stage of our discussion. So my name is Ki-Jin. So I'm an economist at the Economic Research Department. So flow of my presentation is mostly based on our latest ADB brief with the same title, Global Shortage of Personal Protective Equipment Amid COVID-19. So first, I'll be discussing how COVID-19 pandemic has disrupted global supply chain networks. Then I'm going to provide you with a brief overview of the supply chain of PPE, then proceed with how the pandemic has created bottlenecks, followed by how many various governments ADB have responded. Then I'll end with some policy implications and for the future of supply chain of PPE. Okay, so the demand for PPE, as you all know, has reached unprecedented levels as COVID-19 has spread globally. The pandemic does not discriminate, but the impacts do. When it comes to health impact, particularly frontline workers were in dire need for PPE. The healthcare workers are the frontline providers of these health services, which immediately exposes them to higher risk of infection. And majority of healthcare professionals and workers are women, as you can imagine. For example, in South and Southeast Asia, 60% of healthcare workers are female, according to World Health Organization statistics. And these can naturally lead to higher infection rates for female healthcare workers. As you see in the right-hand side chart for, as an example for Italy and Spain. Okay. This is a brief illustration that shows where and why in the PP supply chain there are bottlenecks. So as you can see, the disruptions are broadly felt all across supply chain of PPEs. For example, surge in demand left business struggling to source raw materials, labor, and capital as their production capacity could not keep up with the demand. And then trade restriction as well made matters worse as countries plan to secure domestic supply amid the growing demand for PPEs worldwide. Border closures, travel restrictions, and lockdown also caused longer lead time. This is a brief overview of PP market based on revenues in 2018. PPEs include various kinds of clothing and equipment designed to protect those who wear them from injury and or spread of infection. So the global PPE market in health sector, this chart does not include protective gear in other industries. This is just for health sector. The market size stands at $2.5 billion. As you see, gloves has the high share of sales revenue at 25%, followed by protective suits and face masks. And by region, in the right-hand side chart, North America accounts for the largest share of the market, a third of the market share. Asia share is around 30%. But you should note that this is just based on the revenue of the headquarters. So if we can get where the actual production is coming from, Asia share should be much higher. So there's no official statistics for this, but it is often reported in the media that even the People's Republic of China, or China alone, accounts for at least half of the global production of masks before the pandemic. Okay. Then let us look at first the trade linkages for some PP items. So this data, this is based on the United Nations Commodity Trade Database. First thing you notice is high geographic and regional concentration on Asia, Europe, and the United States. So we are seeing 4 items here: surgical masks, protective suits, and protective goggles, and surgical gloves. So the China plays a central role in producing and exporting many PP products to Asia as well as the rest of the world. So this applies for the first 3 charts: masks, protective suits, and goggles here. For the surgical gloves, Malaysia, Thailand, and the PRC are the top 3 exporters in the world. Okay, then let us look at how the trade link just for an example, for surgical masks has evolved for the past 2 decades. As you see, as Asia, particularly in PRC, has become a production base for many global firms looking for lower production costs. So this can be seen in the increased size of circle for PRC located in the middle. So for example, export of surgical masks from PRC increased around 4-fold from 9% of the total the global export of surgical masks in 2000. So it increased to 40% in 2020. So given the PRC's strong centrality in the global PP supply chain, so supply chain disruption from the PRC will likely have substantial impacts on regional as well as global supplies. Okay. The shortage of PP is also affected by trade restriction on PP exports as well as domestic stockpiling. According to the World Trade Organization, around 80 countries have imposed trade bans covering mostly medical products, including PPEs. As you see on the left-hand side chart, it shows the number of all export interventions by countries. It doesn't show all, but it's highlighting a few items. So as you see, much of export restrictions are imposed on medical products and PPE. So in terms of percentage, so more than 30% of total export restrictions are focused on medical products and PPE items. As for tariffs, PPE items show an average tariff of around 11%. This is for most favored nation, but it can go as high as 30% in some countries. Okay. PPE production has increased significantly as countries reoriented other manufacturers to produce PPE, and they also government provided fiscal incentives for PPE producers. Some governments have asked firms to repurpose their production lines, and for example, government manufacturers in India are producing face masks and protective clothing. And also countries like PRC in Japan are providing financial incentives for firms to expand their production capacity. Even luxury goods producers like Louis Vuitton, they switched from producing perfume to making hand sanitizer. There are also some cases of digital platform usage to facilitate PPE distributions to consumers. For example, Korean government made it available for consumers to see how many masks are available in designated drugstores. Okay, so here let me highlight some of ADB's responses to COVID-19 to address the needs of our developing member countries. We announced as $20 billion package in April, as our Vice President mentioned in his opening remarks. And this also includes $1.5 billion support for private sector as well. And then here's just a couple of things that I want to highlight in my presentation. ADB Supply Chain Finance Program dedicated $200 million to support companies that make and distribute medicines and other items, particularly N95 masks, test kits, gloves, ventilators, and hygiene items and the like. So, an additional financing of $800 million for the trade finance program, which supports cross-border trade transactions, was also provided to mobilize through co-financing. Okay, so to fill the knowledge gap in the information on PPE supply chain, so I captured some of the ADB's trade finance team's unique database, or ADB trade finance team led by Stephen Beck launched a very unique supply chain map last week. So the map, or the database, you can call it as well, it can identify who are the suppliers of the components, or what are the raw materials, who are the manufacturers, who are the distributors for COVID-19 critical goods like aprons, face shields, goggles, gowns, and respirators, masks, and ventilator. I think this is the items that we have in the database. So I believe as we have more data coming in, it can be updated or more items can be added as well. So, and you can also check which banks the firms have business relationship with. It also shows where the firms are located. You can access the map through ADB website. Okay, so here are some policy implications and lessons from past health crisis. So recent epidemics and pandemics, such as 2009 H1N1 influenza pandemic, and then 2014 Ebola virus epidemic, they have provided important lessons for us. Core message is surprisingly similar for the current pandemic situation. The first message is that we should have a better system to monitor PPE use and distribution, and also we might have some centralization of visibility of orders are placed. And then the healthcare supply chain in many countries is designed for efficiency, so which led very little excess inventory. Although this model is beneficial from a business standpoint, but we need to think about whether this is desirable during the times like this. Lastly, we also need an efficient but low burden mechanism for governments and private sector partners and intergovernment agencies to share supply and demand information. Okay, let me conclude by giving you some views on supply chain transformation, including PPE supply chain. So as you all know, many of you know, this is not very new actually, but I believe this would spur more open discussion in the coming future. So the pandemic provided impetus for companies to revisit and transform their supply chain models. So perhaps it would be natural for global firms to consider diversifying their supply chains to other manufacturing hubs in the future, or they could consider the movement to onshoring may get more traction for critical items like PPE. UK and US have already been drawing up some plans to incentivize firms to produce PPE and medicines domestically. You may view this movement or this discussion from the perspective of shift from just-in-time to just-in-case supply chain management. However, the same argument may not work well for complex supply chains such as car manufacturing. So, and also there is a view that this crisis will accelerate digitization in supply chain as well as in trade. Currently, which remains contact-based, paper-based. So I know that this movement has already been occurring in many places, but I believe more discussion can accelerate for our transition to digitization. Okay, this is all I have. Thank you for your attention. I'd be happy to discuss more during the following panel discussion. Thank you. Over to you, Karen.
Thank you very much, Ki-jin. We may indeed come back to you, so please don't go anywhere. I see some questions are coming in. Just to let you know that you can ask questions in the box on the right-hand side, pressing on the thumbs up button just by the side of the question. I'd like to turn, before we get those questions, we have set aside some time for them today, just to answer a few questions, and then we'll get into the live event questions if we could. And I'd like to start off by turning to Michael Griffin. Michael, your institution has very much the COVID-19 pandemic. I just wanted to ask you, is this something that the WHO had expected? And how prepared was the WHO and indeed the world in terms of supply chains for a pandemic of this scale?
Thanks, Karen, and thank you to everybody for having me. The question you submitted is actually quite profound and hard-hitting that we face every day. You know, when you look at the expectations and the preparation for a pandemic, WHO has really focused a lot in terms of staffing, in terms of resources to that pandemic preparedness. We prepared quite a lot in terms of what kind of model would work within a pandemic. We knew what the market disruptions would be. We knew that it would take a whole of society approach to it. We knew that no one organization nor one government would be able to respond. And so that meant for us really a partnership model, a network model, where there's constant communication, constant sharing of information, constant allocation of scarce resources properly. And we have been preparing that for several years via the Pandemic Supply Chain Network, via operations support and logistics, and via working with partners both within the private sector and multilateral institutions, as well as member states. And this complemented the efforts for the disease specialist, for the epidemiologist, and for the data specialist to really be able to scale up a global response. But during that preparation, there's always the kind of the standard obstacles that money for preparedness isn't as forthcoming as, say, money for response, unfortunately. Many of the ideas of a network model, such as a globalized stockpile system, no one wants during non-pandemic times because it's a just-in-time manufacturing system, as Kijin noted. It's the working capital for inventory is quite expensive, but as soon as the pandemic occurs, everybody wants supplies pushed to them immediately for the amounts they need. So we knew there was a real conflict with that. And so by creating the strong partnerships, by advocating proper technical guidance, by disseminating best case uses and working with governments to ramp up the capacity to do this, we had hoped to have a running start for a pandemic. And in many ways we did. We have learned a lot from epidemics like Ebola. We've learned a lot from yellow fever and meningitis on a seasonality basis. So we've taken those lessons and put them to use. Now, there's always the second hand of that question of what we didn't expect. And we didn't expect that the political drivers would be as intense, if not more intense than, say, financial and market drivers. As stated earlier in Kijin's presentation, there's the export bans, but there's quite a number of the implied import restrictions. There was a huge amount of government and private sector pressure going in both ways to ensure that products stayed within a country's borders or got to certain affiliates or subsidiaries in other countries. It really was a non-transparent, chaotic situation that really required political solutions, which is why January, February timeframe, the DG of WHO was quite adamant in terms of easing export restrictions, easing implied export restrictions, working with governments, working with manufacturers. One of the other areas of surprise is that the operational mandate of NGOs, multilateral institutions, governments, and private sector companies sometimes still outweigh a pandemic response. And I think we're seeing that in a variety of different countries right now, from socioeconomic terms, from public health policies, and so forth. The chaos of the whole situation and the intensity of everything, you can always say you prepared for it, but you really never prepare for that kind of intensity until you're in it. Just a quick anecdotal story. Again, the pandemic supply chain network is just really is a communications channel and sometimes market matcher within WHO to the private sector. We never expected for the private sector to come to me or to the private sector network or to WHO to get supplies for them. And that really changed the dynamic of a lot of things. And that started happening in late January. And that's when we really started thinking, what do we do next? Take the preparedness we have, take the capacity we have, leverage the partners going forward. How do we structure internally as well as working externally? And that's what we ended up doing with the COVID-19 supply chain system. Basically leveraging all those assets, all that expertise, putting into basically 3 pillars of PPE, diagnostics, and biomedical equipment. How do you aggregate demand to bring some order to the chaos in the markets, the duplicative requests from governments, the competing of states versus in government agencies and UN agencies and other multilateral agencies was really chaotic to the point that we had to do something, because in the absence of nothing, the chaos would intensify on a daily basis. So that's by bringing in the political high level political support, by aggregating demand, by putting together a logistical network of WFP and private sector, we really tried to do the full spectrum of what a supply chain is necessary for a pandemic response. So that's the basic kind of what we prepared for, what we were surprised from, how we addressed it. And please note that we know there are so many more gaps and areas to continue to fix, but we are moving forward with that.
Mm-hmm. Thanks very much, Michael. I think, Yes, you made very many good points there. I think one of them that you made was the need for cooperation, coordination and collaboration. And of course, bringing in the private sector. The private sector has perhaps become a bigger part of the solution than we ever intended perhaps or expected that it would be. I'd like to talk to Rafaelita Aldaba from the Department of Trade and Industry here in the Philippines. Vita, if I could come to you. You look after competitiveness, you look after innovation in your role in the DTI. Really, how do you see companies being needed to be responding to this? I mean, clearly we need companies to be agile, creative, competitiveness. Kijin mentioned earlier, you know, Louis Vuitton turning from producing perfume to producing hand sanitizer and so forth. Obviously, we've seen auto companies sort of reinvent some of their production lines. We had 3D printers, we've had universities all be part of this. How really do you see promoting innovation, competition and collaboration all at the same time in the corporate sector?
Well, thank you for the question, Karen. Good afternoon, everyone. I'm also grateful to ADB, to the Economic Research and Regional Cooperation Department for inviting me to this webinar and giving me the opportunity to share Philippine innovation experience amid the COVID-19 crisis and the resulting supply chain disruptions as the country was under community quarantine or lockdown. Innovation is at the front and center of our new industrial policy, which is known as Inclusive Innovation Industrial Strategy, or ICUBE-S. This aims to grow globally competitive and innovative industries. And one of our strategies is to close gaps in our domestic supply chain and deepen our participation in global value chains. Another strategy is to link together our innovation and entrepreneurship ecosystem through strong collaboration between and among government, academe, and industry. We are accelerating the commercialization of R&D investments, focusing on market-oriented research. We are embracing Industry 4.0 technologies to create new industries and upgrade existing economic activities. We are reskilling and upskilling our workforce, equipping them with new digital skills and make them Industry 4.0 ready. We have lined up activities in collaboration with development partners as we formulate Industry 4.0 roadmaps, build an Industry 4.0 SME Academy and Industry 4.0 Pilot Factory, and make the Philippines an AI Center of Excellence. And together with other government agencies, we are also crafting an Industry 4.0 Human Resource Development Roadmap. There were two important legislations that were signed by the President last year, the Philippine Innovation Act and the Innovative Startup Act, which would provide funding to implement our innovation policies and programs, support startup development, and build a robust startup ecosystem. As we were in the process of implementing this innovation, startup, and Industry 4.0 plans, the COVID-19 crisis hit us. The community quarantine restricted the movement of people and products, except for essential goods and services. The DTI, the Department of Trade and Industry, immediately issued guidelines for the unhampered movement of cargo and people, covering food and essential products, medicine and medical supplies, along with export activities, including distribution and logistics to support manufacturing, as well as cargo handling, warehousing, tracking, and port operations. And one particular issue was, as earlier mentioned, the shortage of PPE. We do not have a PPE industry, and we are largely dependent on imports of medical grade PPE. With the declaration of COVID as a pandemic, we've seen countries restrict their PPE exports, and then prices rose tremendously. Some of our doctors were forced to use raincoats and garbage bags to protect themselves. And what was most alarming and tragic was the high death rate among our doctors due to the lack of proper PPE. Around April 3 of this year, out of the 107 deaths that were reported, 16% were doctors. So amid this situation, we implemented a manufacturing repurposing program that aims to repurpose manufacturing activities toward the production of COVID critical products like PPE, ventilators, respirators, and test kits. Garments exporters like Reliance and Luentai, who had to stop operations due to cancellation of orders from buyers abroad, slowly moved towards the production of isolation gowns and coveralls, while electronics companies like EMS, IMI, both of which are Filipino companies, and Everwin, which is a US subsidiary, expanded their plants to produce surgical masks, infrared thermometers, and ventilators. Manufacturers of wines and spirits like San Miguel Corporation and Asia Brewery moved into the production of ethyl alcohol. DTI fabrication laboratories, in collaboration with the universities, went into the production of 3D printed face shields. And even our micro and small enterprises tried to help by manufacturing non-medical grade face masks and coveralls. Filipino designers Mitch Dulce and Candy Maristela created a medically reviewed open source PPE design that other countries have used. And as we implemented the repurposing program, there were challenges and difficulties that we have to face. First was the absence of raw materials and lack of medical grade fabric. With the export restrictions being imposed, this was a major challenge to the companies that were repurposing. While the plants and workers are ready without the correct materials, they were not able to start immediately. So after weeks of searching, one company found the right medical grade fabric with certifications. But even after cash payments were made, the order was released in a number of very small batches. And the same is true for the equipment. One had to queue to procure sealants, which are used to cover the seams of the coveralls. These are the blue pipings that you see on coveralls. Now, second was compliance with international safety standards. The PPE tests are not available in the country, and hence materials, prototypes, and product samples must be sent abroad for testing and certification. Without these certifications, the government would obviously not be able to buy these locally made products. Now, let me also share something about our startups. The current startup ecosystem is still young, but full of potential and embedded capabilities. The value is around 378 million US dollars. And mostly our startups are in digital services, around 35% of the total, fintech, 19%, healthcare, 5%, and logistics, 6%. And as we've seen, the application of new technologies like AI, big data, and fintech helped in addressing supply chain disruptions due to the lockdown. Tech startups that were able to adjust their operations quickly have been experiencing rising demand for their products and services, particularly those in logistics, in transport, in fintech, healthcare, edtech, e-commerce, and digital services. Now, to wrap up, there are two important realizations as we tried to address disruptions in the supply chains, both domestic and global. First, the need for manufacturing capabilities for COVID critical products, including raw materials. Government needs to support the creation of innovative activities towards making the economy more resilient in facing future pandemics and other global challenges. Second is the need to embrace Industry 4.0 technologies, pursue digital transformation, and support startups as they create new products and services and offer solutions demanded by the new normal, such as health, transport, logistics, cybersecurity, digital services, finance, and education, among others. A robust startup ecosystem is needed to support the digital transformation of our industries. I think I'm going to stop here, Karen. Thank you.
Thank you very much, Peter. It certainly seems like within the Philippines, the private sector, the public sector are working very closely together to try and solve some of these supply issues. But obviously we know that the supplies themselves, but also the inputs to these supplies, non-woven polypropylene, for example, a critical material in surgical masks, may be produced in one country, but is needed to be used to be made into the masks themselves in another country. So Singnan Park, if I could come to you, is there a case for governments, for countries, even regions working much, much more closely together? And really, how can we make that happen?
Well, thanks, Karen. In fact, regional cooperation really is an essential element for dealing with the supply chain disruptions of medical products, especially during this time like this in pandemic. The global value chain have been stretching very thinly around the world, in fact. And then due to the very globalized nature of the supply chain, it's actually not a single country that will be able to, in a way, monopolize the entire production process. So you need supplies coming from everywhere. But it's not necessarily only like the securing the intermediate goods on the supplies. That's where the regional financial integration, regional sort of cooperation is needed. There are 5 sort of areas that I would really highlight for strong regional cooperation. First, we really need to understand where the products are actually, like the availability of products in the market, and then where the production capacities are, or where the surge capacity actually still remains, and how do countries respond to these supply shocks. So the information really is key, and then the information needs to be really shared among the countries around the world. Also, we need to monitor the supply chain and the quality, the availability and the quality of these medical products along the supply chain. So this, again, given that all this productions and the chains are really interlinked across countries, we need a strong sort of regional cooperation, regional and global cooperation, and also facilitating the surge capacity. There are definitely always, the firm that could have some surge capacity. There possibility of the certain firms to boost the production in a bit shorter sort of time frame, and we need to have that sort of the environment and infrastructure to support these the surge capacity. And we also have to cooperate in terms of the supplying the trade and then the logistics. And finally, regional and then global cooperation is really needed to pay special attention to the vulnerable countries and the vulnerable groups in the country. Okay, so over to you.
No, absolutely, Sin-Young, absolutely. Thank you for bringing up the very much the important need of cooperating regionally. I think you mentioned, as did Fita, the importance not just of having data, but having data about quality as well as quantity. So I would like to move over to Jesper. Jesper, you're in procurement. How important is it to have data, to have regional data, supply data, demand data, but also to have data not just on the volumes, but also on how good these products are and whether they meet the standards necessary?
Thank you, Karen, and thank you for having me on this panel. Well, quality is, of course, essential to all of this, and if we look at the market at the moment, there is a lot of opportunism and offering of products that are substandard. One of the important things in dealing in this market, and that goes for ADB and the UN organizations, but also for health authorities in our DMCs, is an early and continued engagement with the market. Know the suppliers up front, do due diligence very much, and look at the international standards that exist for all of these products. It's important that you build up this basically database of suppliers. It's a very good initiative that the Trade Finance Division in ADB has done, mapping out all of this. We have done the same in procurement or cooperated, and also send out expression of interest, getting responses from the markets. So building that is essential, both during this pandemic, but also going forward, so be prepared for next emergencies, which will definitely happen along the way. Another point is to be very flexible in terms of how we approach the market. One of the challenges for our governments, member states, is public procurement and the view that we have to, that is very stringent rules and there is very little room for maneuvering. It's important to really take a flexible approach and use the emergency procedures that are in all public procurement frameworks. That's what we've done internally in ADB to get contracts very quickly. But it's also, in terms of preparedness for a situation like this, I don't think anybody had expected a complete breakdown of the supply chain, which is actually what has happened. In other health emergencies, it has been limited to geographical areas. We've never seen that basically all air freight has been stopped. Right now, it's prices just for the logistics is 3, 4, 5-fold, 8 times what it used to be. So one thing is being prepared in terms of getting the materials. The other thing is the whole logistics, and that's where stock management and planning for worst case scenarios so that you have quality products at hand. Because no matter how much planning and support to the supply chain, a situation that we've seen over the last 3 months is simply, it cannot be planned for. And there is no easy solution in the short term to address it. And it's difficult to see how you can secure the supply chain when whole societies is on lockdown, both production facilities and logistics services. So it's about engaging with the market, have qualified suppliers, do testing on the equipment, flexible contracting, and plan for worst case scenarios through stock management. I think I'll stop there. Over to you.
Thank you very much, Jesper. Obviously, getting these products to our ports, getting them even to the factory door is one challenge, clearly, but then we need to get them to the communities that require them. That may be, it may be far distant communities, it might be just frontliners in hotspots. And of course, different countries are on different epidemiological curves, different parts of the country are on different epidemiological curves as well. So Susan, drawing on both your knowledge, services expertise and your medical background, what do you think is really needed? How do we get these PPEs, these very critical PPEs, to the people who need them?
Thank you very much, Karen. It's very interesting. I think what we saw in the beginning of the pandemic is everyone was still kind of waiting what will happen and wasn't really realizing we actually have to prepare and get ready. And I think we saw this ourselves here living in the Philippines. And then suddenly it became this huge surge and everyone wanted to buy everything in millions and millions of protective gear, and obviously looking at ventilators and so on in huge numbers. And maybe at that point also we should have been, and hopefully in the future we are more strategic in ensuring that we really focus on those areas and those vulnerable people which need it. And what we saw already in January in Wuhan happening is that the hotspots were really these hospitals, the centralized care providers. In many of our developing member countries, that is the case. People go to the hospital as the first area where you get care, and then you easily infect the health workers who infect, again, the hospitals, the patients who are there, and so on. So first would be really focus on those hotspot areas, on the central hospitals. Obviously, we have now in many countries already dedicated hospitals for COVID care and COVID patients. So we try to quickly create separate service lines and protect people who work in these facilities. And then obviously it also depends on the country's policies of who should be protected. Should everyone wear a mask or not? And again, that depends really on the epidemiology and the intelligence we get. I think one key question is really how do we make sure that all the material and the supplies we procure, that they really arrive at the facilities and that people are protected. And this is where digital tools, GIS tracking tools, even barcoding and so on make sense, where we can then track that the supplies really reach those people who need it, because obviously, as Jesper has mentioned, there's a huge black market, and we don't want to make sure that we want to make sure people, not the wrong people, get at hand to these kind of products. I think the other interesting thing is really how we use these kind of controversial tracing tools that we have. India, for example, is using them not necessarily to trace contacts of people and trace people, but to really identify the next hotspot, where then they already send in advance the PPE, the gear and the education material to the health workers to make sure they are prepared, because obviously in this current shortage, we can't provide everything to everybody. So again, intelligence, targeted protection, and making sure those who really need it are protected. Thank you.
Thank you, Susan, for that very succinct wrap up. Absolutely, it's getting it to the people who need it on the front lines when they need it. I'd like to start looking at some of the questions that we're getting in, because they are starting to flow in, and I see lots of likes as well. And I'd like to first turn over to Michael at the WHO, because there have been some questions about, what sort of numbers are we talking about here? There is one question that's come in. How many PPEs do we figure are needed on a daily basis? I think back in March, you mentioned some numbers in the order of 89 million masks needed monthly, 76 million pairs of gloves, 1.6 million pairs of goggles. Can you tell us how much is being produced globally? How much do we need to ramp up production?
Excellent question, and we work on that daily. I think the current estimates of that 90 million and subsequent numbers for the variety of items within a PPE set are ramping up now. We don't have concrete numbers due to the fluidity of it, but we are working diligently to get those numbers and get them public, because as the question is alluding, that does need to be matched with available production. We have spoken with quite a number of the manufacturers, anywhere between 80 to 90% of the market capacity across the PPE production of items. And there still is that 3 to 6 month backlog. There's still that limited capacity to ramp up any type of surge. Case in point, gloves can only probably be ramped up an additional 10% of global capacity. Gowns have a little more flexibility between 50 and 100% depending on the company. There is a concerted effort, as everyone can attest to, of repurposing other industries for this kind of production, and I think that trend will continue. We are looking at, from a WHO perspective, what we pushed into the market. Again, the number changes on a daily basis. We're up in the tens of millions to date, but we have a pipeline that is either being secured or planned to be distributed in the hundreds of millions of items over the next 3 months.
Thank you very much, Michael. I'm sure this question will keep popping up, so this may not be the first time you answer that question. I mean, if I could ask Peter that sort of same question, you mentioned some ways that the Philippines, for example, is repurposing and is bringing in different kinds of companies. I mean, do you see any real changes within the Philippines happening immediately to try and meet some of this demand that you mentioned earlier? We can't hear you, Peter. I think you need to turn on your microphone.
Yeah, sorry.
Thank you.
For the surgical masks, there are companies that are already selling, that are already able to negotiate contracts with the government. But in case of the coveralls, like what I've said, we still have some issues pertaining to the tests and the certifications. And I think we need, they were just sent the other day, and we need to wait for 3 more weeks before we could get the results. But once all these certifications are issued and approved by the Department of Health, one company alone would be able to produce 10,000 coveralls per day, and that's not yet the full shift. If it's going to do full shift, and together with some other companies, they committed to produce 1 million and sell all this to the government. But in terms of the needs, the need is still very high. We are stockpiling because there might be a second wave, and it's something like 5 million PPE sets per month. So around 167,000 PPE sets per day.
Thank you, thank you. I mean, certification, really important. You mentioned earlier, Jesper, flexibility. Do we need to be more flexible or indeed more innovative in terms of certification? Suzanne mentioned earlier barcoding, for example. This can be a quick way of ensuring the provenance, the proper provenance of some of these goods. Is this something that we should be looking at?
Well, in terms of certification or meeting standards, we should not be flexible. I think it's important that we give the comfort to everybody, especially the health workers in the front line, that the PPE that they're issued actually meets the standards and does protect them. And we should not, just because we are in panic mode sometimes, overlook that. So when we engage with the market, that's the first thing we look at. Does it meet international standards? And we will never be flexible on that point. In terms of tracking equipment, I mean, this is where there needs to be some planning in terms of when materials go from A to B, that everything is accounted for, that there is a plan for distribution, that there is warehousing facilities, and that these are basically monitored. I mean, there were stories in the beginning. Now I'm sitting in Denmark. In Denmark, they ordered a plane full of PPEs, and it was shipped or en route, and everything was fine. When the plane arrived in Denmark, it was empty. And nobody could tell where the materials actually, or the PPE had actually gone. It had touched down somewhere in Europe, unloaded, sold to a higher bidder. So there needs to be some planning and work with trusted partners also on both international logistics, but especially also in country. But we should not be flexible in terms of certification. But if we could have digital barcoding systems and things like that to track materials, that would be excellent.
Yeah, thank you very much. Absolutely, quality is very important, and getting the right and decent products to those who need it, absolutely. There is a question coming in about the COVID supply chain map. Ki-Jin, you mentioned this earlier. I know you're not technically on the panel, but I hope that you could jump in and answer the question. The question is, how was the list on the map first developed, and other ways for companies to get added to the list?
Okay, thank you for the question, Karen. So I think we need to understand why we need this kind of innovative database or map from the beginning. So I think when this COVID-19 crisis occurred, so as a policymakers in each nation, and so the multilateral development bank like ADBs were wondering first that we didn't know who to help. So we know that the banks are dealing with suppliers of PPEs and makers of PPE, but I think actually I'm not the perfect person to answer this question. But my understanding is so it was really needed to identify who we should help. So supply chain and the PPE. So we keep talking about this, but specifically, we needed to know who we should help, particular companies. So I think there was the motivation of this the mapping exercise. So I think this, to my understanding, this is the first attempt in the world to disentangle the supply chain of PPE. So that's why we tried to kind of expedite this process. So I believe that since this is kind of a pilot-like exercise, so I believe there will be a lot of room to enhance in the coming future. So I'd like to ask our audience to please have a look, and if you find any things to be improved, please let us know. So I'm happy to deliver those messages to the trade finance teams. And then I believe that it's it's a work in progress, so it's not the final. So I believe there will be a lot better mapping or the database coming later.
Thank you very much, Ki-jin. Michael, from the WHO side, you've been working on these supply networks. Anything more that you could add from your point of view in terms of getting people together, getting the information in one place?
Yeah, so again, a couple of the initiatives we have is the Pandemic Supply Chain Network. We have a technical network that engages with industry when designing technical specifications. As Jesper mentioned, that there is no lowering of the standards, there's only enhancing them and promoting them. But there's a variety of ways to get involved through obviously the normal procurement mechanisms if a tender or RFPs come out. And again, reaching out to the Pandemic Supply Chain Network through me is a way for us to scope the market, to have visibility of the market, as well as a safe channel for private sector to engage with WHO. We also encourage working with other multilateral institutions because our networks are networked with other networks. So that would probably be the best way to do that.
Thank you very much. I'd like to turn to Suzanne, actually, because you talked a little earlier about these frontline workers. They may be in health clinics, they may be in independent organizations, care homes, for example, and they need this. I mean, do you smaller institutions, if you like, they don't really have the same wherewithal to be part of these big supply chains. Data networks that even
Sorry, Karen, you have to repeat again. You broke up. I couldn't hear the full question, or you have to type it. These are the technical difficulties.
Thanks very much. And you should know that Suzanne and I are actually geographically apart, so that is a little strange. I wanted to ask you regarding these end users of some of this PPE. I mean, obviously, governments, large corporations can be part of these supply chain networks. It's very easy if you're a large entity, if you're a health clinic, if you're a small hospital, if you're a care home, for example, it's quite a different story. How do you see those kinds of entities, those kinds of end users being part of this supply chain network?
Yes, thank you, Karen. I think great question. I was just this weekend, I was actually at my friend's clinic. I used to work here as a doctor also in the Philippines many years ago and have a great network here. And there are two interesting observations. The number one is that many private providers and also private hospitals have to give the cost down to the patient. So right now, if you have any intervention in a private hospital, the surgeons charge 25% additional fee because they have to wrap the nurses and themselves and so on. So the PPE sometimes is then again, the cost is carried by the patients. So that's number one. For the private smaller clinics, and this is also a friend of mine who has a smaller clinic, well, of course, she has to pay it out of her own pocket. She has to source it herself. Quality might be questionable, depending on where she gets it. They're not necessarily standards in terms of, does she need now some kind of plexiglass cover in front of her desk? Does she need ultraviolet light to disinfect something or not? So I would say it is very difficult because obviously the health professionals, they are also scared and afraid. They want to protect themselves and their staff. And at the same time, the patient, and they have to cover this out of their own pocket. And I want to say there's something that it's, of course, it's a terrible catastrophe that we are facing, and there are many, and it's a deadly disease, but the collateral damage on private health facilities is huge. Many are going bankrupt because they don't have the usual business. Essential services are not necessarily currently being provided. People are scared to go to the hospital, obviously, so people losing out. So this particular friend of mine is now only making around a third of what she would normally do. And of course, she has all the costs of the PPE, all the additional measures and so on. Which is very difficult. So what I want to say is not all PPE is necessarily paid by the government. Often it's shouldered by the patients or then by the private providers.
Thanks very much for that, very, very concrete perspective and an excellent example there. I want to go from the micro to the very macro, if I may, over to Sin Yong. We have a question here regarding a free trade agreement. Question is, ensuring the flow of essential materials for PPE production with minimum trade-related impediments is important in addressing the shortage of PPEs, both at the national and at the global level. So how can we be using free trade agreements? How can these be leveraged or harnessed to guarantee the easier flow of PPE materials and PPE products? Sin Yong.
Well, in principle, you really should not impose that export bans and then trade restrictions during times like this. But many countries tend to fear some abrupt sort of shortage of the domestic supply and then rely on these export bans. This actually happens not only for the PPE, but also the kind of like a staple food. And then we saw that experience in the global food crisis in 2007 and 9. In fact, what really came up is there's some sort of like a regional agreement not to resort to this type of sudden trade restrictions or export bans. And the situation should be similar even in the PPE. We believe that there might be some special agreements or also perhaps even like a special attention to facilitate the flows of the critical goods, not necessarily only on the PPEs, but we can have some agreements on what sort of the critical products we will protect from this type of international trade disruptions and then supply disruptions.
Thanks very much, Sin Yong. We have a question here for Secretary Aldaba. Fita, the question is, Does Manila Port offer a fast lane for imports of PPE and inputs into PPE? And has the government centralized the purchase of PPE?
Yeah, that's right. Government has, with the, well, a state of emergency has been declared, and a law, Republic Act, it's called Bayanihan Act, Hilasuan. So this actually centralized the purchase of critical items, critical goods like PPEs and medical supplies. And apart from centralizing it, well, of course, the goal is to reduce all those unnecessary steps and ensure that we'll be able to procure those PPEs at the soonest time possible. And in fact, millions of PPEs have already been imported, and you can see a big difference in terms of the prices. Whereas before they used to sell, for example, the coverall would sell for something like 1,200. Right now, you can get a medical grade for 800, and which is also the price that we're targeting for those that would be domestically manufactured. And then the other question, I forget, Karen. What was the other question? The centralization and
have you centralized the purchase of PPE?
Yeah, that's the one. I thought you asked another question.
And then Manila Port. Is there a fast lane for imports of PPE and PPE inputs?
Yes. I forget to mention as well that based on the Bayanihan Act, all duties, taxes, and other fees being charged by different government agencies, all of these have been waived. And also in terms of the processing of the import of all these imported medical devices and medical supplies and other critical goods, the process has been shortened and facilitated. In fact, I think there's very little inspection going on because of the urgency. I mean, given the urgent need for us to be able to distribute all this necessary equipment and other medical supplies to the various hospitals in the different parts of the Philippines. Yeah.
Thank you very much. Thank you very much for that complete answer, Vita. I'd like to turn at the WHO again, if I could. The question is, what is the prioritization of PPE in low and middle income countries? And how long, or two questions actually, how long is the procurement process from placing the orders to getting the PPEs?
So the length of the procurement process actually is not as clear as we'd like. That really has to do with manufacturing capabilities as well as distribution capabilities. So we are looking at, anywhere between 7 to 21 days, depending on the situation, the country, and so forth. We hope to improve that as soon as possible. The issue in terms of allocation, that's the COVID-19 Supply Chain Task Force, was to address just that. Knowing that the market is disrupted, knowing that there's very little coordination, and that the G20 plus countries have the political and financial clout to enter the market, the COVID-19 supply chain system really addresses those most vulnerable countries, 130, 140 countries. The allocation of that is based off a variety of factors. With the purchasing power of the variety of partners within the COVID-19 Supply Chain Task Force, we then hope to allocate to those countries, and the factoring involved in epidemiological trends and absorptive capacity is what we call it as well. And once those factors are taken into consideration, we then figure out clinically and ethically who gets what scarce resources. It's a tough decision because not everybody's going to get what they want due to the lack of market capacity. But by being transparent with this allocation model, we hope to provide enough insight of how we are doing it so that there is both an equitable and ethical consideration beyond just a first come, first serve or who has money.
Thanks very much, Michael. Thank you. There are some questions about standards and certifications related to the supply chain maps. I don't know if this is something you feel you can answer, Ki-Jin. Is it possible to add quality standard and certification to the database? And perhaps that's something that Jesper can comment on afterwards as well.
Yes, maybe I can add something to the question. So, you know, the database is actually a public good, so it's open to anybody. So, and I think all the data we upload is subject to confidentiality, and maybe if it violates the company's private information, then it is not allowed. We are not allowed to upload. So I think actually I believe we've examined what kind of variables we should upload. Of course, it's subject to data availability, but I think this is something maybe I cannot, you know, exactly answer, but maybe it's worth be examined by trade finance team. Maybe Jesper have other comments.
Well, I think it would be a tremendous task to certify and do due diligence and look at the quality of the products of the entire list that has come out of the supply chain mapping. I think the usefulness of the tool is for both companies and governments alike is to start looking at what type of suppliers are out there and then starting to do their own due diligence, contacting the firms, because just getting names of suppliers when you enter into a new market, that for some governments this is a new market, is a difficulty. I don't think, at least not in the short term, that we would be able to certify or give quality assurance on the whole list of these suppliers. Over.
Thank you very much. We've got a couple more questions for Michael, if I could direct some more to you. Michael, the question is, will the WHO be developing uniform guidelines or requirements for global compliance to set technical requirements for key PPE? Or indeed to ensure uninterrupted goods?
Yes, actually, and to add to Jesper's comments, you know, WHO does provide the technical specifications for PPE. We do perform quite a bit of the due diligence work, and kind of adding to what Jesper says, the scope of that is quite substantial. So we have kind of put a checklist together for manufacturers to provide the right documentation, and if we have to, we can, on a case-by-case basis, do lab testing as necessary. But WHO does provide quite a bit of technical guidance on PPE. It provides rational use of PPE as well, and it's all available on the COVID-19 response website of WHO.
Mm-hmm. Excellent, excellent.
Yeah.
Maybe I can just stick with you very quickly, and you could quickly respond, and I'll go to Fita afterwards if I could. The question is, what is the role of PPPs in the production or distribution, I guess, of PPEs, public-private partnerships, that is?
That's, again, I think that is out of the scope for WHO. The public-private partnerships really come down to how we can network or how we can connect, still promoting and disseminating technical specifications and guidance by WHO. Where we have to be very careful is we can engage on PPEs, but we cannot endorse any one company or organization, which is why network models is such a strong path for us, because it includes the entire market. And if it includes the entire market and everybody, in theory, everybody meets the technical specifications and the ethical considerations that may come into allocations, we then can work quite well. It gets into the issues of discrepancies of quality. WHO cannot work with tobacco companies. We start getting into a lot of those regulations that we have to be careful about.
Thank you, Fita. And anything from the Philippine side of things? I think this is something that you work on very closely.
Yeah. PPP, the public-private partnerships, we are very much open to that. In particular, right now we are discussing various modes in terms of building testing laboratories to do the tests and to issue certifications for PPEs that are being manufactured here in the country. And let me also share that the current efforts, the manufacturing repurposing program, it's not only to address the crisis, but looking beyond the crisis, looking at, well, we've entered already the new normal, where based on various studies, what is being said is that there would still be demand for PPEs in the future, and hence the Philippines is actually preparing, intensifying, and government supporting all these companies, because we're really starting from scratch. Like what I said in the beginning, we have nothing. We don't have the textile industry, we don't have the PPE industry, but we have garments firms. There are also electronics firms that are moving towards this direction, and hence working together with the private sector, either through providing both fiscal and non-fiscal support, or maybe partnering through PPE with the private sector in terms of putting up those necessary facilities in order to ensure that the ecosystem that will really be able to create the PPE ecosystem here in the country and be able to sell these products not only domestically but also export them. And that's the reason why we're really keen in terms of being able to comply with all the international standards. And maybe, can I say something more?
Absolutely, go ahead.
Yeah, I was just thinking, I mean, along the course of our discussion, it just occurred to me that probably we could do some regional cooperation in terms of building regional PPE, regional value chain on PPE. I mean, it's not only the medical grade PPEs that would be needed, but there's also demand for the non-medical grade PPE, and even within the entire medical grade PPEs, like for the coveralls and the gowns, of course, there are various levels, and of course the specifications along with the tests that would be required would depend on what level or what specific PPE you are manufacturing. And hence, probably it's really important for countries to work together, cooperate, so as to be able to create a regional value chain. And in order for all of us to cooperate and be able to, I mean, be ready for future pandemics, as well as other global difficulties or disruptions in the PPE value and supply chain.
Thank you very much, Vita. I think that's probably a very good place to end. If I could just very quickly go around the panel and ask, are we ready? We've been talking about supply chains for the pandemic that started at the beginning of the year. Are we ready either for a second wave of COVID-19, for the next stage, perhaps the recovery stage, where we'll be needing things like plastic dividers, for example, maybe face masks, different kinds of equipments as we recover and enter the new normal that Fita mentioned about? Or are we prepared for the next pandemic? If I could ask each of you to give maybe 1-2 words maximum, just as we head to the bottom of the hour. Michael, can I start with you?
Work in progress, and we're encouraged by it.
Excellent, excellent. Can I go next to Susan?
Thank you. I'd like to cite one of my colleagues and friends, Dr. Fazila from the Ministry of Health of Malaysia, who said the pandemic actually showed us that we can take a whole of government and whole of society approach to solve these very difficult challenges. And there's no excuse anymore when we go forward and when we have the next pandemic or the next climate crisis or anything else. So definitely we learned a lesson. We are getting better prepared. As we go to the new normal, please don't forget hand washing. It's not just PPE.
Absolutely, absolutely. Sin Young, can I go to you, please?
Sure. Well, I think, yes, there is a risk that the pandemic or any other epidemic come in waves, but they don't really come global in the very first place. So if we work together, there's always a better way of making the supply chain more resilient.
Mm-hmm. Thank you, thank you. Jesper, are we ready on the procurement front?
We are getting there, and there's a lot of lessons learned, and we should take this opportunity to start developing capacities in our DMCs on this issue.
Thank you, and thank you. And Fita, if I can ask you to have the last word on this. Where are we in the Philippines?
Well, 3 C's, cooperation, collaboration, and coordination, all very important in order for us to realize the goal of having a resilient PPE supply chain, not only in the Philippines, but throughout the region. I think that's really important in order to prevent countries from imposing trade barriers in the future. Whenever there are pandemics or whenever there is a crisis, then they start becoming very protective of these supplies.
Thank you very much. Thank you very much. Well, we have come to the end of our session. I'd like to thank everybody who's been listening in and sending the questions and participating in the discussion. I would, of course, like to thank our expert panelists, Fita Aldaba, Undersecretary for Competitiveness and Innovation at the Philippine Department of Trade and Industry, Mr. Michael Griffin with the World Health Organization, looking at strategic development and public-private partnerships, and from the Asian Development Bank, Sin Young Park, Director with the Regional Cooperation and Integration Division of the Economic Research and Regional Cooperation Department, Ms. Suzanne Roth, Principal Knowledge Sharing and Services Specialist with the Sustainable Development and Climate Change Department, and Mr. Jesper Pedersen. He is Principal Procurement Specialist with ADB's Procurement Portfolio and Financial Management Department. Our next webinar will be on June 11 at 10 a.m. Manila, Hong Kong, Singapore time. This will be a frank discussion on the policy recommendations being employed and needed indeed going forward for developing economies in the COVID-19 era and beyond. We very much look forward to your participation again. Thank you.